In some, the threat level's high. It's really very high. In fact, it's probably the highest level that we've seen in the past several years. The threats we're most concerned about are those which disrupt patient care and patient safety, specifically high impact ransomware attacks, which have had a regional and sometimes even a statewide impact on patient services. And based upon publicly available data provided by HHS's Office of Civil Rights, we're seeing at this moment in time, we're at 331 breaches impacting 32.4 million individuals. And the nature of those breaches really fall into three categories. The first type of breach that we're seeing are the traditional data theft attacks. Second type of breaches, we're seeing an increase in third-party attacks, basically cyber adversaries using business associates to come in and attack hospitals and health systems, and supply chain type risk. Third, and most significant concern for us are ransomware attacks that have increased dramatically, targeting hospitals and health systems.
We have a treasure trove of data. We have a lot of potential for operational disruption, which makes us a very attractive target to threat actors. What I would suggest is the highest level of threat right now for us is email. And that's the way that most of the threat actors are actually trying to attack, because it's the simplest and most effective for them.
The COVID-19 pandemic has really exacerbated the situation by providing much more of an attack surface for the bad guys because of the increased use of telehealth, telemedicine, remote workforce. And of course, all the hospitals and health systems are dealing with reduced resources to deal with the increased attacks due to a loss of revenue and shortage of highly trained cybersecurity professionals.
One particular challenge that the healthcare sector faces is the introduction of legacy systems. This can make understanding the environment that makes up a healthcare system all that much more difficult. And this is happening more and more frequently. We're seeing that owners and operators of these networks don't know what all they need to be in charge of protecting. So that can be one key step towards understanding what you need to protect, is understanding what legacy systems may have been integrated over the years.
I think the best way, and the first thing that I would focus on, is really to identify what is normal so you can understand what's abnormal. And by that, I really mean, what are those procedures, processes, what are those system things that you need to be looking at to identify what normal and what good looks like, so that way you can identify the bad and be able to do that in a quick, succinct fashion. So I think an example of identifying the abnormal is really to baseline, let's say, an inpatient clinical role. So a nurse, right? A nurse working in the EMR is an example, right? In your medical record system. If that nurse is doing certain kinds of behaviors and certain kinds of transactions on a day-to-day basis, you should be able to baseline that. And there's tools available to do that and help you with that. But ultimately, identify what that behavior looks like, and then put monitoring and instrumentation in place that actually says, hey, something doesn't look right. Maybe this nurse is starting to, or this nurse or job role is starting to do thousands of transactions in an amount of time that's just not possible. So that could indicate either a system problem, right? It could also indicate, maybe just poor training or some sort of issue going on, or it could be a compromised account.
I think inventory is the operative word and really a big part of the answer. Having a dynamic inventory of all your clinical information and operational technology assets, the endpoints, the applications, and internal and external network connections, incredibly important. Seems like a fairly simple and straightforward process and request to make, but in practice can be extraordinarily difficult to implement. Then that's just the tactical and the practical. Then we have to understand how vulnerabilities present in those systems, that technical risk, translates into business risk and enterprise risk. How does it translate into legal and regulatory exposure? How does it translate into risk to patient care and patient safety, and ultimately reputational harm?
In cybersecurity, I often talk to companies who have done a great job at shoring up their own defenses, and they aren't sure why they need to be worried about third-party risk. But one way to think about it is if you were to install a world-class security system in your own home and give the alarm code out to a number of outsiders, your security system would only be as strong as it would be when those trusted outsiders were able to come inside. And that's the same as third-party risk. You're opening up your networks and your environments to additional individuals, and in this case, in many cases, it's companies who are coming in and introducing additional potential risks into your environment. It's incredibly important that we know all of the third parties that are operating in our environments, and not just that we know them, but that we tier them. We understand what types of information they have access to and how having them in our environments can potentially introduce additional risk. It's also important to know that we must have third parties. We can't build safe and secure networks purely internally in many cases. And so the introduction of these additional utilities can provide additional security to our networks. But we need to know the risks that we might be introducing and make sure we're doing the right things to prevent them.
The first thing that I would focus on is getting away from the point in time risk assessments that we do and moving more toward continuous evaluation of risk and continuous evaluation of supplier security. The second thing that I'd focus on really is around incident response and ultimately making sure the right contractual terms are in place, the right planning and playbooks are in place, and that you actually exercise and tabletop those with your key partners and suppliers. The one thing that I would suggest is really to stay away from the fear, uncertainty, and doubt. It's really easy to get into conversations around what could have happened, what will happen. Look at what happened over here, this other organization. I'd rather have the organization focus on what are those tangible metrics that are actually going to move the needle, right? How do you identify what are those right things that are going to help you measure risk reduction? And then ultimately reporting those to a cybersecurity steering committee, and that committee being comprised of a cross-functional group of leaders that can give you input and feedback as you're evaluating risks, as you're evaluating how to mitigate those risks, and ultimately, putting context to trying to help the organization.
It's also incredibly important that senior leaders know what the key metrics are that they want to hear about when it comes to cybersecurity, and that they're getting briefed on these regularly. Any good information technology department is seeing tons of risks every day, and senior leaders don't necessarily need to hear metrics on every single type of issue that is facing our IT leaders. But they do need to understand the types of metrics that they're going to hear about on a regular basis in order to benchmark their own organization.
It's also very important for the leadership to receive regular briefings from their information security teams, understanding what are the strategic cyber risks and what are the tactical and technical risks that they currently face. Very important for them to brief up to specific committees in the board. And I think it's very important for the full board to receive an information security briefing, cyber threat briefing at least once a year that demonstrates the importance and significance of the issue with the board and therefore makes it a priority for the organization. I think it's absolutely critical for the boards and senior leadership to understand that cyber risk is not just an IT issue. It is truly an enterprise risk issue, which has the potential to impact every function in the organization, and every function in the organization has the ability to either cause cyber risk or help mitigate it.